So hello my dear students, welcome to this video. I am Dr. Jazeer your dermatology faculty at Physics Wallah MedEd. And in this video, I am just continuing the Residency Explorer series and we'll be talking about this branch, Dermatology today. So there must be so many passionate doctors among you who are looking for this lucrative branch that is dermatology. So I just want to give you a basic outline about what happens during the residency, what is the entire program like, what is the kind of life that you'll be looking forward to once you choose this branch as for your residency and your way ahead in your future. So what happens in this branch? Let me just start it on a continuous note. What do a dermatologist do? Okay, so in dermatology, as you know, that when you are doing your dermatology in your MBBS days, you must be knowing that you'll be dealing with many of the skin diseases, which starts from the common diseases like acne, eczema, etc., and then it goes towards the very particular diseases like psoriasis, vitiligo. So you'll be dealing with all these cases. So not just these dermatological cases, but you also will be dealing with the sexually transmitted infections as well, because it is dermatovenerology, right? So in venerology, all the sexually transmitted infections is also going to be seen, and along with that in India, we'll be dealing with leprosy as well. So all the dermatology cases that you must have learned in your textbooks, along with that STIs, that is sexually transmitted infections, and also leprosy are the cases that you will be seeing most commonly in a dermatology department. What happens during the residency, isn't it? So a residency which is going to last for 3 years, you will be well versed with all these common presentations of dermatological diseases, because in any college, in any hospital, you can see that there is an increased patient inflow for dermatology OPD. So you'll be able to see all the common diseases. You'll be able to also understand how do you manage all these common dermatological conditions as well. Now, other than this, you also will be having to do some investigations, right? So you'll also be concentrating on how the common potassium hydroxide test or the other investigations which is done in dermatology like the skin biopsy and all is also done. So these days there are a lot of advancements that is happening in dermatology, especially when it comes to lasers, fillers, etc. So you'll be also well versed with the various laser modalities and fillers, etc. that has been used. Now, how about this branch? What are the attractions of this branch? See, if you are someone who is looking for that adrenaline rush about managing those emergency cases, then this department is not for you. So this is a department which is quite peaceful. You'll be having a nice work-life balance, because we are not dealing with emergencies as such. So you'll be getting all these patients, but you require a lot of patience as well. Why patience? Because you are going to deal with a patient who may not be recovering very soon. So we'll have to keep that patience to continuously follow up the patient, to give them a long-term treatment. But what happens on the long run is you are going to build a very good relation with the patient. So the doctor-patient relationship is going to be good because they are under your follow-up for a longer period of time. So I agree that you'll be getting many small cases like fungal infections, superficial fungal infections, etc. But for those patients who are having vitiligo, psoriasis, pemphigus, etc., this requires a long-term follow-up as well. Now, is there any super specialty when it comes to dermatology? What do you think? Yes, just like any other department, dermatology you can go for some super specialization in terms of fellowship, or you can focus on dermatopathology, isn't it? Surgical dermatology, where you'll be dealing with all those small surgical sessions as well. And you can also focus on research when it comes to mycology, etc., where there is a lot of scope in a country like India, because you are getting a lot of infections where mycology separately is considered to be having a lot more scope, because there are multiple infections that is seen in immunocompromised patients. So something like penicillosis and all, where you can concentrate on mycology. So that is another section as well. But among all these sections, what I would tell you for the future, the scope and how lucrative this department is, that is now going to be cosmetology itself, because the awareness that everybody has to have a better skin, and also about getting a much better skin and then doing multiple procedures. Everything happens as a part of cosmetic dermatology. If you're someone who is interested in this cosmetology as well, then this is going to give you a lot of satisfaction based on the latest procedures. It ranges from small procedures like chemical peeling, etc., and it can go up to various types of lasers, where you'll be learning about different types of laser based on the skin manifestations like ruby laser, ND-YAG laser, etc., and then all these things can come under cosmetic dermatology as well. So that is all about this department, that is dermatology. So what I would say is it is a blend like of seeing the common dermatological cases where you deal with the common cases along with various infections. It can be common bacterial infections, fungal infections, etc. But if you have an interest of dealing some surgical procedures, then obviously you can try that as well. And then if you are interested in research or doing something different, then you can focus on dermatopathology or research skills as well. So this is again a broad department, but as you must have read, this is a daughter of medicine. It is the youngest daughter of medicine. That is how dermatology is mentioned. So if you're interested in this department, go ahead. It's a great department to be, and I hope that many of you who are seeing this video today, so tomorrow you're going to be an excellent dermatologist in the future who is going to excel in its field, and I wish you all the very best. So thank you so much for watching. I'll be coming up with more videos in the soon.